I'm Sally A. Curtis from Monetize Your Content. Despina, who is our great guest today, is a clinical dietitian and a psychologist. She's a passionate healthcare educator and communication consultant for healthcare professionals. A multilingual international speaker who works around the globe with people from different cultures, religions, and beliefs. Her focus lies in the work with your patient approach, a system which she created to help practitioners understand their patients better and realise the effect of their initial assessment on diagnosis and treatment. So please help me welcome to the show, Despina.
Thank you. Thank you for inviting me. Very excited to be here today.
Thank you very much. And I know it's an early morning for you, so well done and thank you for joining us. To kick things off, I'd love to ask you, what started this quest for you? What's the backstory?
Oh, this actually goes back into my childhood. The very first experience was, I was a little child when my grandfather was, he broke his arm and I had to visit him in the hospital. So from that moment on, I wanted to become a doctor. So growing up, it was my dream. But at the age of 12, or 11, 12, I became a volunteer at a local hospital. And I used to help people who come from overseas with the language, with the translation. So I used to go in with the doctor with them and, translate the whole conversation, etc. And there is what drew my attention was the first encounter between health professional and patient, which was so important, more so for the patient. Because every time we would go out, so what do you think? How did you see him? Or was she good? Or, so that was so important for the patient. And I realized that that was not something which was taught to health professionals. It was something that just, depended on their persona, on their upbringing, on their background. There was no real the didactic part in it where health professionals were actually taught how to approach a patient, especially in their first encounter. And this made such an impact on me. So growing up after that, after I saw what a doctor's life is really all about, I didn't want to become a doctor anymore. But the medical field still was my interest. So becoming a clinical dietitian was just such a great fit for me. And then psychology came in as well. And the focus of my interest was patient approach. How do these two meet and how do they communicate? And today I can say that I've been dealing in that field for more than 20 years, 25 years. And I've joined every association that dealt with it. And, throughout the years, you could see there's so many different approaches that came out. I investigated each and every one of them. I became a health coach. I was a coach for 3 years, and then I did experiential psychology. I did so much research, and I got so involved in the different aspects of human communication. But every time I investigated a methodology, there was something missing. It was not quite there. Very good steps, but not really what it should be. So eventually I decided to put together all my knowledge and experience and make up my own theory, which sat well with me, and called it the WWYP Approach, which is WWYP, work with your patient, work with yourself, work with your patient. And the trick in this theory is that health professionals need to first turn the mirror themselves
Mm.
before they approach the patient.
Mm.
So all the theories out there give instructions and lists how to approach the patient, but if I'm not ready and fit to do that, then so this theory is based on. And today I'm in a position where I educate health professionals on this system, and I teach them to approach patients.
Mm.
And I use this approach in one-to-one to my clients or patients.
Yeah.
And it's very productive because what happens is at the end of the first meeting, we come to the so-called unique diagnosis of a person. Each and every one of us is unique. So we cannot all have the same diagnosis, because diagnosis is not just the disease. It may be for a health professional, but if you want to really reach a successful treatment and management, you have to diagnose the person. You have to know. So this is basically what I do.
Yeah.